Hello guys, mambo vipi? Call me Prince Sky and this is Prince Sky TV in compilation na Jenrika YouTube channel. So manze, siku ya leo nimeweza kuwakaribisha for one of the biggest interview about most tumesikia about leukemia, that being a terrorist disease or a worst disease, but kuna mtu mmoja ndio nimeamua kuwaletea ili aweze kutuambia history yake, alianza aje na ilimpeleka aje na sasa mpaka akakuwa declared free from leukemia. So guys, join me and make sure manze, kama subscribe, hit subscription button hapo kwa Prince Sky TV, na ukiingia pale YouTube kwa Jenrika YouTube channel na uweze kusubscribe ili ukaweze kupata more episode ambazo zimekuwa lined down for you guys. So karibuni sana. So ma'am, habari yako?
Nzuri sana.
Karibu sana, hapa ni Prince Sky TV na siku ya leo nimeweza kutafuta ili ukaweze kutuambia ulianza aje na jani yako na hii shida ya leukemia, na ilianza vipi na ulijuaje uko nayo na ilianza aje? Je, ukaniambia fans wewe ni nani?
Naitwa Jenrika Wanjohi and yes, I'm a medical doctor. Let me just hit the point on the head. I'm also a pastor currently. And in 2011, I became diagnosed after having a few symptoms of lack of blood and being fatigued. I got diagnosed with leukemia. It wasn't so easy to diagnose because to start with, I had a big spleen and the anemia, the lack of blood, a low hemoglobin level. And it took us weeks to be able to get to the diagnosis. The spleen was so big, it was occupying, literally the whole of my abdomen. And I was looking like a 9 months pregnant woman, and it wasn't a very good thing to even imagine. So what I did was I went to see the doctor and I told him I needed us to work on this spleen and see what is happening. We had done all the other parameters like checking the amount of blood and checking whether there was infection, whatever. And apart from the hemoglobin level that was low, everything else was literally okay. The white blood cells were okay, so it was totally very confusing.
Okay, and to begin with, you talk of hemoglobin. Can the issue of hemoglobin be maybe an issue whereby it triggers the leukemia?
No, it doesn't. The hemoglobin doesn't trigger the leukemia. It's the leukemia. Leukemia is a blood cancer. It's the one that will make your hemoglobin level go down. Yeah, because the normal is supposed to be anywhere from 12 grams per DL to all the way to 17. After that, it's dangerous. Below the 12 that I've talked about, it's also a problem.
Okay. And so umesema ilikuchukua like weeks before you find out that kuna issue ya leukemia,
yeah,
ama spleen ilianza kuwa na issues. So after you noticing that kuna leukemia and from your background of medical, okay, ilikushtua?
I did not get to know immediately that it was leukemia. What I knew I had was anemia.
Okay.
And there are several reasons why you can have anemia, especially when you're a woman. And, we looked for all the reasons we knew, and there was nothing to lead us in this or that direction. It was very, very confusing. And we knew it had something now to do with the spleen. I was thinking maybe I'm having something, like they get in regions like Kitui, leishmaniasis. And we went and, I did not want to have small things being done on me. I was scared. So what I told the surgeon to do for me was to take off the spleen. And it was taken off, and it was weighing 3.5 kilograms. And that's a very, very heavy spleen. After it was taken off, my general condition went down. I lost weight and many, many other bad things were happening, and I was very anemic. I got transfused with 8 units of blood at that particular point in time. Then they were like almost not able to control the whatever, the bleeding. But by the grace of God, the control was accomplished. The bone marrow reports from the bone marrow that was taken from me was not giving us any answers. And it was a real struggle throughout the whole of December. I actually did not know what I had. All I knew was I have anemia. I have a condition that is making me go down, my general, whatever the weight loss and everything. And to tell you the truth, I started thinking, could I be having some HIV? And we went investigating in that direction.
Okay, and what made you think that you might be having HIV?
That's what I wanted to stay away from. So my husband had died of HIV, but God, in 1994, I had asked God, can you allow me to get out of this marriage? Because if I continue staying in this marriage, I see myself getting HIV, and then my children will be left without parents because, from the behavior of this mzee, things are not acceptable. Whatever I'm seeing is not acceptable.
And okay, and from your medical background, when tumeshughulika sana na unajua hii condition na hii au kulinganisha na ukaona maybe hii haikai HIV?
No, there was everything that would suggest HIV, weight loss, the anemia, all that. And, the presence of the spleen. Sometimes you can have a big spleen or no big spleen. Yeah. But I was tested and the HIV was ruled out.
Okay. So after HIV was ruled out, and also like leukemia. So ile time sasa kuna leukemia. How did you feel now?
Okay, let me show you. In 1 month, from November 2011 all the way to December 2011, to the end of December, I was in the house and I was weak, wasn't going out, I was being actually looked after. So what happened in that month, I kept on losing weight. I kept on, going from bad to worse. So this one day I told myself I need to go to hospital and repeat this full hemogram and see what is happening, because something must be happening and this thing is evil. So I went and I was tested. That time they had given me a lot of injections. I didn't even like the idea of having a prick on my body. So I told the lab tech, I'm a doctor, sometimes we don't like doing what we do to others. So I told him I'm a doctor and I really do not want you to use a big needle on me. Can you please use a small one? I have been suffering from this and that, and they've been giving me a lot of injections. I just don't want to withstand pain. Let's use the smallest needle. So see, he has heard I'm a doctor. And he comes, with that sympathy, uses the smallest needle, gauge 25. You use it for babies. So he gets the blood, goes inside and does the test. And he comes and stands at the door of this waiting place. So it was just me and whoever had taken me. So he says, Daktari, how long have you had this leukemia? Are you getting it? I had not thought that I could be having cancer. So I just fell onto a seat. And he was scared. He was scared of what he saw. So I told him, please don't worry. What you have told me is the best thing that could ever happen to anyone. Because now from here, I have a weapon. Because doctors normally will not tell you, a doctor will not tell their doctor colleague that you have this and that. They'll leave the thing to you to read for yourself.
Okay, my question is it a proper way to maybe tell a patient that you have leukemia without maybe having gone through some cancer?
You need to go through cancer. You need to be counseled about the condition. But I'm telling you, the doctor to doctor, This is a step they evade. They don't want to be the ones to come out with the bad news for you. So instead of coming to tell you this is what is happening, what they do is they give you the report and you read for yourself. So this lab technician actually helped me by saying it. I didn't have to go to struggle with my doctor. It was just a matter of giving the paper to him. So the guy looks at the paper, the doctor looks at the paper, and he starts looking at the back, and there's nothing at the back of the report. So I told him, I know I have leukemia. Can we talk from there? Is there medication for this thing? Or is it a death sentence? So now I knew I had set him right. And that's why was able to encourage the lab tech guy that you've done me a big favor. In all the reports that we had, in all the blood tests that we had done, there had not been anything abnormal except the hemoglobin. Now here it was an obvious thing to me, to them, and yeah.
Okay, and after maybe you discovered that you on leukemia, journey na hii leukemia ilikupeleka aje?
Okay, let me say one big thing. I'm a born again Christian. I believe in healing. I had seen God heal me of small things. There's a time He healed me. I had a sty over this eye, and He healed me just like that. You know, I don't know whether He sent an angel to just rub it off. I felt like it was rubbed off during a worship service, and I knew God heals. Now, when you are given that death sentence and you know God heals, there is a shock first. So I wanted to get the medical thing, to get the medical treatment, follow that line as I build up my faith and get the fear out of my way. Yes.
So after umeanza umesema you are born again Christian, so that is, I think that is the most encouraging thing kutumia ku encounter this condition. So when ulianza matibabu, so unaweza encourage, kuna mtu ako pale nje ako na hiyo issue na ana undergo a lot of maybe stigma and like kama this is a death sentence, unaweza mwambia aje?
Okay. There is hope, and God has given us hope. All the diseases, those that have been discovered and those that are yet to be discovered, they have been covered. And the cover is the beatings that Jesus got. I don't know how it works, but I know it works. I have seen it. I saw it with the sty. I had seen it with other small sicknesses in my children. And I knew that if I waited patiently enough, I was going to see Him heal me of this leukemia.
And what was the impact? What was the impact on leukemia on maybe you and your family?
Definitely, they had seen bad things happening to me during the month of December 2011. And when they heard there was some treatment I was going to get, there was that hope that started to be built in them. And then I didn't allow any fear to come into me. I didn't allow anybody to come to sympathize with me. I knew where I was going. I knew I wasn't ready to go to heaven. I knew I wanted to be with my children to give them a foundation before I go on the other side. And I knew I also hadn't done God's work.
Okay.
Yes.
And did you have any support from maybe an extended family, or you fight it alone?
My family was very supportive. They stood with me, but you would be surprised. Even as they stood with me, I'm the one who was giving them encouragement. Skinny as I was, defeated as I looked in their eyes, but I'm the one who was giving them encouragement, because they would come and they would start crying, and the tears wouldn't help anyone, but of course it relieved them, and I would encourage them that I'm not going to die. In fact, I was ready to leave. Psalm 119 verse 17 says that I, Generica, shall live and not die, that I may declare the goodness of the Lord in the land of the living. And that is what I was focused on, getting my healing.
Amen. Kama kuna mtu go through condition za leukemia like this, inaweza kuwa hope na kitu itakusaidia ili ujue with support na Christianity na utaenda mbali. And kuna kitu moja sijauliza medication ya leukemia, is it much expensive?
In fact, I will call it the grace of God. When we went and they went specific to diagnosing exactly what leukemia it was, mine was chronic myeloid leukemia. There was only one medication that I was required to take, and it didn't cost me 1 penny. The only cost that I used to come through, it was the cost of transport from where I was working that time. I was in Maua Methodist Hospital that time, at the time of the diagnosis, and I worked there for a long while. Yes.
Unasema leukemia iko na type ngapi?
There are many. I can only specify on the one that I know. Yeah. The chronic myeloid leukemia is the one that I'm specifying. This one, it stays, you may have had symptoms even earlier, but you may not even have known. Like I had recurrent anemia. I was living in Mombasa, and I thought it's because of the recurrent attacks of malaria and the fact that, I had been of the childbearing age. Yeah.
So mtu ana battle any condition, please don't give up. Kuna hopes. Umesikia, like believe in healing and believe in God, because yeye ndio master wa kila kitu na ndio sio. Nasikia maisha tunaishi ni kama script, so yeye ndiye ameandika, sisi wengine tunaipitia tu. And please mom, before tumalize, you being a pastor, unaweza pea mtu wako huko nje encouragement mwenye anapitia any condition. It doesn't mean kama ni leukemia, but any condition. Mwenye ana feel like ni kama ako in death sentence, tunaweza mpea hope.
Yes, let me tell you one thing. We serve a God who has taken care of us in every way. And he did that long before we were born. More than 2,000 years ago, he sent his son Jesus Christ. And he was beaten. Those beatings that you saw in films like The Passion of the Christ, they were real. He was beaten. And the reason for that beating, we are told, it is so that we could get healed. And there's no, like, you will go to hospital and they'll tell you there's no medication, there's no treatment for this thing. You just go home, wait, and die. You're not going to die. You have to stand strong, and you have to be focused on wanting to live, because the condition that you have, and it doesn't matter whether it's a common cold, it doesn't matter whether it's cancer. Yes, it is true. We say as doctors, there's no medication, there's no treatment for this thing. When you get it, we just wait for you to die. That is not right. God says he gave his son, that in Isaiah 53, that by the beatings that Jesus got, we were healed. Not we are healed, we were healed. So it happened that time. It's now available for us, and it's only by faith that you can receive it. So by prayer and believing and trusting in the Lord, Mark 11:23 and 24 say, have faith in God. Whosoever says to this mountain, and sickness is a mountain, whether it's big or small, it's a mountain. Whosoever says to this mountain, be taken up and lifted and cast into the sea, and does not doubt in his heart, but believes that what he says will come to pass, it will surely be done for him. And that is what happened to me. I cast off the mountain of leukemia into the sea, believed it in my heart that God had done it. The price had been paid, and healing came in 2016 June.
I hope mmesikia mimi sitaki kuandika information inakuja direct. So this is episode 1. Manze tutakuja na more episode, very encouraging one. Kama uko mbele mwenye amekufa moyo, umesikia ni pastor. So tutakuwa tuna line up very many episodes tunatakuwa na encourage na ile perspective ya being a Christian and a doctor, both at the same time ikikuwa mixed pamoja, itakuwa ni very powerful thing. So manze, bye bye guys, see you next time. Wacha atupe social media handle zake, alafu manze unaweza piga support. Hatuhitaji pesa yote, ni just subscription, with subscription button, alafu unaweza share with your friends and utakuwa umetufanyia jambo la busara sana. So man, unaweza peana namba yako, unaweza peana, kuna mtu anaweza taka kukupata akuulize swali, so unaweza mpea namba, peana social media handle, mtu anaweza kupata wapi?
You can write there 0720253776.
Alright.
I'm there on TikTok, I'm there on YouTube, but
TikTok anaitwa Jendrika Wanjoy, pia YouTube channel ni Jendrika Wanjoy. Pia unaweza mvisit kwa kanisa yake pale Ngoingwa Rika, ukuja usikie na maybe
Hope Recovery Church International.
okay. So
Ngoingwa Business Center.
Yes,
in Classic.
Pale Ngoingwa Classic inaitwa Hope Recovery. Maze, kama unapoteza hope unaweza kuja urecover hapo kwa church. Karibuni sana and God bless you. Bye bye. See you next time.